another video from the CTAG Clinic. My name is Dr. Mike Lloyd and I'm the Clinic Director. In this video we're going to be doing a part 2 on dissociative amnesia, following on from the previous video looking at the signs, symptoms and the diagnostic criteria. In this video it's going to be very much more about some techniques and some ways of understanding why dissociative amnesia occurs and how to overcome it in day-to-day life. Firstly, I wanted to say that this often feels to me as a therapist like one of the most difficult parts of dissociation for a person to contend with. While it might help in some respects, for example losing large chunks of traumatic memory from the past, which can actually be useful for people in that it doesn't get in the way of their everyday life now, not having a consistent understanding and sense of what is happening on a day-by-day basis sounds awful. And to not know what's happening or to approach events and not be able to remember them afterwards really does have a huge impact on people's lives, and it can often be one of the most distressing things. Certainly when a person finds themselves in places they can't account for, they don't know why they moved to that place, they don't know where they are sometimes, or they may even lose track of the sense of their self. These are really scary and frightening characteristics of dissociation. So even though we talk about dissociation being a protective factor in a person's trauma, it doesn't necessarily mean that it feels like it's doing a person any good. And I've often, in many conversations when we talk about amnesia in clinical sessions, I have a huge amount of empathy for people that are going through this, because it's not something that I experience. So to lose that sense of who you are or where you are and what you're doing or what you've done, I think it's a really awful part of functioning that a person has to go through when they're dealing with dissociation. And always recommend that people seek professional help with this from therapists that really understand trauma and really understand dissociation, because there are things that can be done to help. And I suppose a warning message is useful here, that if a person does start delving towards their memory or start trying to work at improving any amnesia that they may experience, the warning is that it might work. That a person might start recalling things, and that means from day to day that might be absolutely great for them in that they are much more aware of what they're doing on a regular basis, but memories from the past can suddenly start becoming much more apparent. Now these might be things that a person has already known, but more detail comes in. For example, more emotional memory may occur, or more narrative memory may occur to really kind of add the colour to what might have been a black and white memory, if you like. That a person might really have a sense of what they've been through and recall so many more parts of their childhood, and that can be extremely stressful and extremely frightening. These things can come in the way of just flashbacks during the day, dreams or nightmares during sleep, and a person can become very confused and very upset at remembering things that have remained hidden from them through the process of dissociative amnesia for possibly many years. Again, the context of therapy is important so that you're able to get help and be reassured about the nature of this process ultimately being helpful, but on a regular basis it can be really intimidating and frightening for people to go through. The key point is that within all of these processes it's the brain trying to help. So dissociative amnesia is set in motion by elements of the brain in order to protect the person from overwhelming traumatic experience, likely early in childhood, but not always purely in the case of dissociative amnesia, but it is most commonly done. So the brain is there to help protect the person from being overwhelmed by traumatic sensation, and it doesn't necessarily know when to stop doing that in everyday experience. So the context of this is always trying to remember when this is occurring, when these symptoms are happening to a person, it's there because the brain is trying to help. The brain is very good at doing it, but not very good at knowing when not to do it, certainly in the non-traumatic experience of a person's life. So I'll give you two techniques to work from. They're both sort of intertwined and ideally done within the context of a therapeutic relationship, so that you can discuss this, you can plan this, you can work this through with your therapist and know when to time it and when not to do it. One of the elements is about recording things, so being able to have a sense of the consistent, regular, day-to-day patterns and routines of life. So this is for people that have significant levels of dissociative amnesia, where almost daily or certainly weekly, large chunks of that person's life are absent. They cannot account for things they're doing, they cannot account for places they're going. Now nowadays with smartphone technology there are simple ways of being able to manage this. It might become annoying, but it could be really useful, is to set a 15-minute or 30-minute timer alarm on your smartphone, so that on those time intervals the phone rings and we are generally triggered in a good way to listen to a phone and pick it up and respond to it. So if a person is having a dissociative amnesia episode and the phone rings, it's entirely possible they'll come out of that amnesic episode because of the phone ringing, because other aspects of our brain, other elements of our brain are designed and triggered to listen to that sound. We're very good at this. So if you set it for time intervals, keep a notebook to hand. As soon as that phone goes off, the phone tells you you need to record where you are, what you're doing. You do that on a regular patterned basis, maybe for a week, to collect data on what it is that you're doing. You'll start seeing some patterns emerge of particular times or locations or contexts of your life when these dissociative episodes may be happening. They might also bring you out of those dissociative episodes much more quickly than might normally happen, which could say be 2 or 3 hours. This might bring you out within 15 or 20 minutes, and you get a sense or an opportunity to be able to look around you, give yourself safety messages, let yourself know that you're safe, that nothing bad is happening, and that you are in a place where you can understand and you can make some notes about what's going on. That might actually reduce dissociative episodes anyway moving forward, but it certainly might reduce the amount of time you spend within a dissociative episode. So within that, the other technique is around the safety messaging. This is about learning the language of the brain, being able to talk to the brain to let it know that you do not need to have amnesia today, tomorrow, next week, the week after. That to try and hold the sense that the brain is doing this to try and protect you. It learned how to do this many, many years ago, most likely, and it is repeating patterns. The brain is excellent at learning something and repeating it over and over again, but not so good at knowing when to stop doing it. This is true for all aspects of dissociation, but for amnesia in particular, the brain can suddenly click into amnesia mode very quickly because your physiological state has changed. So you could be walking along the pavement, try and cross the road, you step out, a car beeps you, and then suddenly your heart rate goes up and you might be triggered into a dissociative episode. So it's important to be able to say to the brain as often as feels possible, I am safe. Nothing bad is going on. I might be anxious, I might be stressed, I might be scared, but I'm safe. No one is harming me. I might be anxious because I'm about to do a job interview or take a journey that I've not taken before, or have to make a phone call that I really didn't want to make, like complaining to customer service. And these are things that cause us to become stressed, but we are not in danger. Being able to communicate that to the brain really, really can help to let the brain know that it doesn't need to trigger amnesia mode. Try and see the brain as being like a tool. It works on automatic, but it can improve its functioning with training and with guidance. So to get used to talking to your brain, to reassure it, if you see your brain as being a bit like a frightened, reactive child, it will always respond in the same way to the same thing, and it needs to be matured, it needs to be developed. Brains in trauma mode are often designed in the past, and we need to upgrade them and level them up into the present. And that's a language thing. It's learning how to speak to the brain. Don't feel silly about doing it. It's a really important process to take place. You can do it quietly or you can do it out loud, whichever suits you best. And lastly, not to be frightened or not to be too stressed out where possible about having amnesic episodes. These are really, really common in people with complex trauma and with dissociation. When you are realizing that they've occurred, to be able to reassure yourself to say, I'm okay, my brain is simply triggered, it's dissociation, I understand why, I understand the context, I'm okay, nothing bad is happening. The faster you're able to relax and just see that as the brain trying to help, the better you'll be. As always, it's about just knowing this brain isn't your enemy. The brain is your friend. If you're able to communicate and collaborate with it, it'll do you a lot more good. it's trying to help, it just gets the timing wrong and it makes mistakes. And if you're compassionate towards your brain and compassionate towards yourself, you stand a good chance of reducing both the frequency and the length of time that these dissociative amnesic episodes may take place. I hope this has been useful to you. As always, if you'd like more content coming from the CTAR channel, please like and subscribe and you'll be notified of things as they crop up. So hopefully I will see you next time in another video, and in the meantime, take great care.